Fertility drugs are available to treat many of the conditions that cause infertility. They can increase the chance of conception when used to overcome problems at any stage of the menstrual cycle. Many fertility drugs work at the hypothalamus or pituitary gland to influence the production of hormones, which help induce ovulation or stimulate the ovaries to produce more than one egg. We'll go into the details of these methods next. In ovulation induction, hormone therapy is used to bring about ovulation in women who are not ovulating normally. The goal in ovulation induction is the release of one mature egg. Most often, fertility pills are used for ovulation induction. Fertility pills are taken orally and prescribed for 5 days in a row at the beginning of a menstrual cycle. As with many medical treatments, there can be side effects, and you should be aware of them. Most women who take fertility pills do not report side effects, but those who do may have headaches, hot flashes, breast tenderness, visual disturbances, abdominal discomfort, and nausea. The main risk of treatment with fertility pills is the risk of a multiple pregnancy. If fertility pills are not effective, injections of gonadotropins may be necessary. These are hormones that act on the ovary or brain to promote egg development. Ovulation induction can be followed either by intercourse or intrauterine insemination, or IUI. Ovarian stimulation is one of the most common forms of fertility treatment. Fertility drugs are used to stimulate the ovaries. Their goal is to grow several mature eggs to increase the chances of pregnancy over the single egg that normally develops each month of a woman's cycle. Ovarian stimulation is often prescribed in combination with timed intrauterine insemination, or IVF, and other forms of fertility treatment. Here's how it works. Gonadotropins are hormones such as FSH or LH produced by the brain that stimulate the ovaries to produce eggs. The necessary hormones are given for several days in the form of an injection. Every patient is different, so the injections are followed by careful monitoring by a fertility specialist to measure the development of follicles, the increase in blood hormone levels, and the lining of the uterus to time the injection, which will cause ovulation to occur for IUI. The follicles and uterus are routinely monitored using ultrasound scans to determine the progress and best time for ovulation. Blood samples may also be used to determine the best time. Temporary side effects may include inflammation at the injection site, mood swings, breast tenderness, abdominal bloating or discomfort, fatigue or restlessness, and headache. There are also risks associated with the use of medications that induce ovulation, including an increase in the chance of high-order multiple births, such as triplets, and the development of ovarian cysts. An additional risk of treatment is the rare occurrence of ovarian hyperstimulation syndrome, or OHSS. Symptoms for this syndrome can include severe pain in the pelvis, abdomen, chest, calves, nausea, diarrhea, vomiting, bloating, weight gain, and difficulty breathing. There is a 2% chance of this condition, and careful monitoring will help avoid it. Other fertility drugs, known as GnRH analogs, might be used to enable the fertility specialist to prevent ovulation during assisted reproductive technology cycles. Some of these forms of medication have side effects, which include hot flashes, vaginal dryness, mood changes, and depression. Human chorionic gonadotropin, or HCG, is a hormone that is naturally produced in your body during pregnancy. It is used in fertility treatment because it is known to bring about the final maturing and release or ovulation of mature eggs. HCG is given at the end of the treatment cycle once follicles are mature. Like the gonadotropins, HCG is given by injection. Side effects after an HCG injection are extremely rare, but can include inflammation of the injection site and ovulation-like cramping. You should keep in mind that because there is no single successful formula to ovulation stimulation, it can be a process of trial and error. Your doctor's experience and their knowledge of the way various stimulation drugs can affect you is of paramount importance in finding the right formula for you. So good communication and realistic expectations about the time it can take will go a long way towards helping you get the best out of your fertility treatments. And remember, we're here to talk about any concerns you have along the way.